So I said that we would sort of start at the top and think really as strategists about this. And whenever I'm thinking about starting a strategic conversation, we have to start with what are the economics of this situation? That's going to help us to drive our behavior. So just a few recent pieces, I would say probably over the last 3 or 4 months here from Pierce Healthcare, but talking about how the trade winds of stars in 2024 are not easy ones. We have fewer health plans this year that will be 4-star plans than last year, and fewer last year than the year prior. So for those that are sort of close to these economics, we know that some of the ease that we had during COVID, those things are starting to be stripped away, and we're reconciling back to a little bit more of a rigorous environment with respect to stars. And we're starting to see all of those things take effect in terms of just how the distribution of 1 through 5-star plans is allocated here. One thing I'm also just bringing to the forefront was, this is affecting the biggest of the big. So Aetna, I think, very publicly had lost a Medicare Advantage star, and to the tune of $800 million or $1 billion. And when asked about sort of reconciling that and saying, what do you fundamentally need to do to start to right that ship and get back on track, the focus was on experience. Those things that might be showing up in CAP surveys, those elements of our star ratings that we know are based on member experience are crystal clear in the forefront of even the largest plans that are battling this. So to say that all of this is, again, that general premise of we need to have a strategy that puts us in the best position financially, and that needs to really think about our reimbursement constructs. These are just a couple of nice examples of how real that data is. So if I sharpen the lens on that and I say, okay, I get that it's about star ratings, but what does that really mean and feel like in practice? I think it's useful just really quickly to, rather than just throw out the terms, it's a 4-star plan, it's a 5-star plan, what does that really mean? And if I look at what are called the cut points of these different star ratings, and I'll focus our attention to the top left here, getting prescription drugs, getting those needed drugs, the MAPD part of our star ratings, you would have a 5-star plan that had 91% efficacy here, and you'd have a 4-star plan that had 90%, and a 3-star plan at 89%. So we're looking at 2 or 3 cut points or percentage points in terms of participation as being the difference in, depending on the size of the plan, could be tens of millions of dollars. And I look at this not as it's a razor's edge of, oh my gosh, what if we fall by 1%? I look at it as there are huge opportunities to just jump up a little bit, even with really solid practices that are touching a few thousand people, might be all the difference that you have to make. And so this is really intended to say, we've got that motivation to move up just a little bit, and anything that we can grab onto and drive a more positive experience or drive more clear communication that helps members take the right actions, that can have an outsized benefit from a financial perspective.